you mentioned a couple of things which were associated with a worse outcome. These were radiation therapy and neck dissection. Um, so I guess the first part of my question is, are those discoveries now changing the practice of how doctors treat these tumors? And if you could also just explain what neck dissection means.
Yeah, so in terms of neck dissection, and of course the surgeons here can chime in to give greater information, but it's moving through the neck anatomy to really identify tumor, resect completely tumor, and identify if there are any lymph nodes that may suggest more advanced disease. It has always been a controversial question of whether it's an important aspect because it's known that it, can have this impact. So really how our results inform this discussion is shedding greater light onto the pros and cons of going down these treatment routes. In some cases, it may still be important to have adjuvant radiation and neck dissection, but it provides insight into how it may impact patients and to have that conversation with patients as they're deciding what approach they may want to take and what potential impacts it can have on their life versus treating their disease.
So these are things that affected quality of life, but were they things that actually improved survival, although they decreased quality of life? Is that what that
Right.
means?
So that's what the power of the CORSICA database is, that we can start to ask those questions of quality of life versus outcomes of disease, and then understand where is the balance between those two important outcomes that we should have in a really personalized manner for patients.
I see we have a question from Joseph. Would you like to unmute and ask your question?
Sure. My question is, how do we get patients who we suspect have these conditions into one of these academic centers before they have procedures at the local institution?
So one of the important things that we're trying to do with CORSICA is really widely distribute our work at national meetings. We're publishing and trying to create a body of literature to really disseminate these findings so that either patients who are at other institutions, hopefully their doctors can start to become aware of the implications of our findings, and also if they feel that they're not if they feel that they have the means to go to some of these institutions, they can be aware that these institutions are really working on understanding the long-term outcomes, both in terms of disease and also in terms of quality of life. And so they can use that to sort of get second opinions or altered courses of treatment.
Great.
I might just add.
In follow-up, surgeons are surgeons. They like to cut. How do we get them to one of these institutions before? If you have a suspicion, is there a way to get them to these 10 institutions before they have surgery?
Yeah, maybe I'll address that. Sabrina, you've done a great job answering the questions. And it's a great question. I think that every institution that takes on sinus cancer usually has a multidisciplinary already set up because of this understanding that surgery is always the answer, or surgery plus other modes of treatment may be what's best for a patient. It goes back a little bit to your question about, how do we get patients to the centers that are equipped to handle patients? And what I would say is that, even though I think that it remains a challenge, and certainly we see patients, I think all of us in CORSICA as investigators have patients that have sort of languished, in somebody's practice without the adequate suspicion that there is cancer going on, because it is rare. But at the same time, there are now more and more specialists being for this type of treatment. surgeons, yes, but surgeons who are aware of the multidisciplinary treatment options for sinus cancer. So when I've been doing this for a while, when I started, and I knew that I wanted to do rhinology as my field, I had choices for subspecialty treatment for fellowship after finishing my training. And now there are 32 programs that offer a similar type of fellowship training. So we are generating many more specialists who have an understanding of rhinology, understanding of the role of surgery, but also have the understanding of the multidisciplinary nature of sinus cancer treatment and to involve chemotherapy doctors as well as radiation therapy doctors.